Hi viewers, this is Dr. Sowmya Dogiparthy. So let's talk about hair fall in general. So hair fall has multiple reasons. Like we spoke about, it can be internal or external reasons. Let's talk about the internal reasons. So when we are stressed out, see, every single human being is stressed out. There is no human being without stress. There is some amount of stress that leads to changes in our skin and our hair. So stress can cause hair fall. Vitamin deficiencies can cause hair fall, especially vitamin D deficiency, vitamin B12 deficiency, hemoglobin deficiency, and your serum ferritin deficiency. What is serum ferritin? Iron content. When the iron content is not storing properly, even that can lead to hair fall. Thyroid can lead to hair fall. Okay, sometimes lipid profile. If your cholesterol is high, even that can play a role on your hair. Okay, so now what are the ways to tackle hair fall, both medical aspect and like aesthetic aspects? So now medically, obviously vitamin supplementation that is required for your hair, which is prescribed by your dermatologist, and some adjuvant procedures for hair fall control are. When I say adjuvant procedures, it means it is not monotherapy, it is not the single way. This is hand holding therapy to make sure the hair fall is controlled a little more faster by these procedures. So what are these procedures? We have platelet rich plasma therapy, which is your own blood that is taken out and centrifuged, and the platelet rich plasma is separated and injected back into your scalp under painless situations. So topical anesthesia is applied and injected, and these are all FDA approved. And then we have your GFC, growth factor centrifuge therapy, which is nothing but the same PRP that I just spoke to you about, which also is combined with growth factors that are derived from plants and some vitamins, which are mixed with your blood and centrifuged and injected back into your scalp. Okay, and we also have now advanced treatments like mesotherapy. What is mesotherapy? Mesotherapy is nothing but growth factors, vitamins and stem cells that are plant derived that are injected to your scalp. And now the most recent 2025 advanced treatments for hair growth needs are exosomes therapy and monothreads. What is exosomes? Exosomes is nothing but human stem cells, whereas mesotherapy, we said it is plant derived and vitamin derived, which is not human derived. Whereas exosomes, it's human stem cells that are micro needled into your scalp. This is not injected into your scalp. This is micro needled into your scalp. So what is the advantage? This is, since it's a stem cell that is derived from human, meaning bone marrow or umbilical cord, you will see results much more faster than the other treatments. So, but why is it not frequently done for everybody? Because it's the most expensive treatment, because you're using a human DNA. So since the usage is like a stem cells, it's more expensive but result oriented, and it is FDA approved for microneedling. It is not FDA approved for injection, because why? It involves a stem cells, so it is only microneedle. And now the other procedure is called monothreads. What is this monothreads? Like collagen threads that are like injected into your scalp. Okay, and what does this do? These threads stimulate collagen stimulation to the follicle, make your hair follicle stronger so that it holds more hair. Like any hair follicle should be holding 3 to 4 hair strands. As hair fall happens, your follicles start holding lesser hair, maybe 1 hair or 2 hairs, and the follicles tend to become closed. So these monothreads are inducing collagen and fibrin formation in the scalp follicle to make the platelets and growth factors like reach the root of the follicle and make your hair shaft grow. So these are the adjuvant procedures that are done along with your treatments of medicated treatments for the hair, like using your proper shampoo, using your hair serums, using your vitamin tablets. So besides this, these are adjuvant therapies.